Hello, my name is Rachel Desain and I'm the director of Flaxworks. This is the presentation that I gave at Medicine 2.0 in London in 2013, and it is around how user-centric design has created more effective online health information services. I'm lucky enough to have worked with a great company called Health Direct, which is an initiative of the Council of Australian Governments to deliver national health services, such as telephony, nurse triage, after-hours GP, National Health Service directories, and of course a range of online health information sites. Australia, like many countries around the world, is facing increasing demands on its healthcare system. This slide here shows some data from a recent Australian Institute of Health and Welfare report and shows a typical day in our country of 22 million people and the interactions and growing burden on the health system. We face an ageing population, an increase in chronic disease, particularly fueled by lifestyle-based impacts such as diabetes. And although we have more doctors and diversification in specialists, the carers and nurse workforce is shrinking. There are still massive gaps in regards to the health of our Aboriginal people and the tyranny of distance for those in remote areas where, for some, getting to your post office might require a full day's drive. And something I don't think gets spoken about very often is that the digital natives are becoming parents, and when you do become a parent, you start to get very interested in healthcare. We often focus on the demands of the baby boomers, expecting a higher level of service for their 80-year-old mum, or they themselves as they start to need more health services. But I see the expectations from a generation that expects to be in the driver's seat and manage and control their tools like they do in banking and hospitality. They expect to be able to do the same thing in healthcare. And they have no such brand loyalty as their earlier predecessors. They will happily swap healthcare providers to get what they want in a way they want. And I believe this is a good thing. I believe we'll see some real innovation come from young people. I just hope the patriarchal culture of medicine and the regulatory environment within government can create a space for these new ideas and new voices to be heard. In August of 2013, Flaxworks conducted a survey of 1,200 Australians, asking them where they go for health information. And we see that 78% of people have gone online for health information in the last 12 months. This is down slightly from when a similar study was conducted in 2011. However, similar to the recent findings in the article in Wired, we're seeing that general time online has gone down. And as we see here, we have a high number of people downloading apps to their phone, and this may be why we've seen this number drop slightly. However, regardless of the device used to access the service, a key priority was easy to understand information presented in a user-friendly manner. The full survey highlights have been made into an infographic video, and there's an executive paper available as well. So if you look on the Flaxworks site, you'll find a link to it. Leveraging this new connected world that we live in and providing patients with access to trusted quality health information is a way of addressing the challenges of health literacy. This is not new. Health information websites, generally developed by academics and government, have been around for quite a while, but generally good design has been thought of as not that important, particularly with tight budgets. And often you end up with sites that nobody really use, and more people end up going to other sites. And because many of us are not educated in terms of online literacy, so where did this information come from? Who published it? What's the rationale and reason behind the publication? That you end up with a situation where a lot of people get very confused and concerned about the information and don't really know where they're going or what they're reading. The survey showed us that 25% of all users felt overwhelmed that there was conflicting information online, and in fact 18 to 24-year-olds, 21% of them stated that searching for health information made them feel distressed about what may be wrong with them. So to help deliver more effective online services, I was brought in to work with Health Direct to support them with their digital strategy. You see here up on the screen the old Health Insight, and it's actually a really brilliant smart solution with some great content there developed by the librarians within the health department. However, it was very poorly presented to the user, and in fact our original usability research found that only 8% of people stated they would return to the site, with the key reasons being usability and design. From talking to users and also looking at the body of fantastic research out there from people like Susanna Fox, Pew, NHS Choices, we developed this, our guide of what people looking for health information online need. And it's finding that balance between clinically safe and accurate content, but presented in a way that's digestible, actionable, and appealing. We developed a methodology that revolves around iterative, user-centric design principles, and it's got to have a strong base of governance. So what are your requirements, ensuring that you stick to your budget, that your vendors and suppliers stick to their budget, and also really importantly, a website's like a tree. Once you plant the seeds, you will have a living, breathing organism that you need to support and grow. So it's really important that you look at your business as usual processes of what will happen once the site goes live. How will you manage and monitor comments, feedbacks, keeping the content fresh and new. That's just as important as the activity. In fact, some would say more important than the activity you do during the design and relaunch phase. Some key principles to consider when you start with your user research is to think about, typical things. Who will use this site? Why are they coming? How do they usually find this information that may not necessarily be online? And how does this fit in with their normal behaviour? Or if the service is going to be used by in a working environment, what's the workflow that this person is in? We did a comparative study comparing a range of international health information sites, including WebMD and NHS Choices. And you can see here on the screen some of that. So think about the tools that you have to gather this research as well. Tobii eye tracking can be very useful, particularly if you're doing task-based activities, creating a profile, for example, that type of thing. It's important as well to think about the bigger picture. Sometimes people just focus on the online experience, so they think it starts at Google when somebody types in a search word. But think about where were they when they thought they needed health information. If they just come from seeing a doctor, is it 2 o'clock in the morning and my son is sort of sick in bed? And then importantly as well, when they leave your website, what are they doing with the information? They're sharing it, printing it, downloading it, and what are they going to do with it? So it's a bit of a buzzword, but try not to think multi-channel. Try and think cross-channel and how you can work and weave all those things together to make a better experience for your end user. Another thing you should think about is emotions. It's not just about the words on the page, it's the feelings that people have. And we found in our research for aged care, you see on the screen here something I'm extremely proud of, the My Aged Care site that launched in July this year. We found that there was a lot of fear and a lot of guilt involved, and using narrative storytelling and strong, striking visual images. The photography here is just beautiful. Was a great way to support the message, and many of you will know soap operas were created by the soap company to help sell more soap. It was a good way to put in a story with aspirational people, product placing ideas and concepts, and it led to a lot of sales. So we thought, why can't we do that in government? Why can't we create these narratives that product place, if you will, the different services that are available to people? And so far it's worked very, very well. They're beautiful videos, and I recommend you check them out. So over 18 months, the team that I had working for me there, wonderful, talented, great bunch of people, very lucky to work with them, created these 6 new sites, and really proud of them, and they've seen some fantastic results. Pregnancy, Birth and Baby, our telephony and online counselling service, has seen a massive explosion. You see here the old site and new site, and we've had some brilliant feedback. But for me, the great thing as well, I am a business person, and it should be about money. This is taxpayers' money that we're using, and it should be used in an effective way. And the whole purpose of this talk is to try and show you that investing in good design and usability actually leads to savings in the long run. Some of you will hopefully remember the screen I showed earlier of the old version of Health Insight, and here you have the new version. We made an optimized version for mobile. We see a massive explosion in the use of mobile to access information online. That's no different in healthcare, and in fact 40% of our access currently for Health Insight is through mobile. Big thing for me though is that we have a 92% increase in the time on the page. So that time that we took to really understand how to structure those topic pages, those articles, has been worth it. And the other thing, we have social media tools there for people to be able to share the content with others, and I think that's a great way also to see if people are behind you and advocating for your brand. And it's a great tool as well to help promote and market your site. Use the power of the crowd to do that for you. So my summary would be that co-design and user-centric design principles should be an essential part of designing a new product or service. Design and creative, it's not a frivolous waste of money on what some people say is fluffy stuff. It's a proven way to ensure your product or service is useful to your end user and can drive success. I do not believe in technology for technology's sake, or because it's the shiny new thing, or design because it's trendy or cool. I work with my clients to ensure that what they build is sustainable, actionable and effective. And I've seen the proof that taking the time to understand your user and design an engaging, effective user interface is the most cost-effective way to drive uptake and success. There's still a way to go. Sue Zeebland spoke about the digital divide. We often see the early adopters and those that are IT literate coming on board first. So in effect, the people who need the most support to improve their health literacy and overall health are the least likely to go online and seek information. But the survey also showed that more people who identified as non-native English speakers are actually going online for health information than the native English speakers. I'd love to see continued investment in not only moving to more user-centric design principles and health online, but also to how we support our marginalised community members to access these services too. So thank you very much for your time. My details are on the screen. If you'd like to get in touch or want to get a copy of the research, would love to hear from you.